Welcome to the Society for Health Psychology's DCT Q&A panel. It is my pleasure to be the moderator for today's panel. My name is Madeline Conser, a graduate student at Rosalind Franklin University of Medicine and Science and current intern at the University of Chicago in the Adult Health Track. I'm also the outgoing chair of the Student Advisory Council, also known as SAC, and I look forward to introducing our panelists shortly. But first, I wanted to review a few housekeeping items. So first, our program will be recorded. Anyone who speaks during the panel, for example, to ask a question, is agreeing to be recorded and is granting permission for the recording to be posted on our website. Second, we encourage you to put your Zoom on speaker view rather than on gallery view. Today's program includes a structured discussion with our distinguished panel and then an open Q&A segment. You may also use the chat function at any time throughout to share your questions or your perspectives, which will be saved for the Q&A segment. You may also unmute during the Q&A to ask your questions aloud. So it is my pleasure to introduce our panelists today. We have Dr. Lisa Matero from Henry Ford Health System. We have Dr. Jennifer Ledroski from West Virginia University School of Medicine, and we have Dr. Jamie Matthews from Jesse Brown VA Medical Center. So we'll start by having each DCT share a bit about their clinical interests and their role as a DCT. We'll start with Dr. Matero.
Hi, everyone. Like Madeline mentioned, I am Lisa Matero, and I am a clinical health psychologist and researcher at Henry Ford Health System, which is in Detroit, Michigan. I'm also the director of our psychology internship program, which has a health psychology track, an adult neuropsychology track, and a pediatric neuropsychology track. And then I'm also the director of our health psychology fellowship program at Henry Ford as well. I supervise, on the internship side, I supervise the consultation liaison rotation as well as a research minor. And then for fellowship, I supervise the rotation, the research rotation. The interests on research are specifically within obesity and bariatric surgery, integrated care, and pain management.
Thank you. Dr. Ledroski?
Hi, everyone. My name is Jen Ledroski. I am a pediatric psychologist, and I am the very new, like less than 6 weeks new, internship training director here at WVU. Where we have an adult health psychology track and a neuropsychology track. My clinical interests are pretty varied. We wear a lot of hats here. I work with pediatric GI, cleft palate, some chronic kidney disease kids, and supervise those experiences, as well as a multidisciplinary training clinic with psychiatry and social work for the internship.
Thank you. And last but not least, Dr. Matthews.
Hey everyone, I'm Jamie Matthews. My pronouns are she, her, and I'm really excited to be here. I'm the director of psychology training at the Jesse Brown VA Medical Center in Chicago, Illinois. So those of you who may not be familiar with our site, we are located just near downtown Chicago in the Illinois Medical District. And in my role as DCT, I oversee administratively oversee all of our psychology trainees. We currently have 20 trainees with us across 3 training programs, which I manage, the psychology externship program, a predoctoral internship program. We have 6 positions in that program, including 1 health psychology position, as well as 3 general track interns, a neuropsychology track, and an acute crisis intervention track. And then we also have a small postdoctoral fellowship program. Currently, we have 3 positions across 2 tracks, which are the PTSD, pain, and substance use disorder track and the serious mental illness track. And clinically, my interests, I have a health psych background, specifically worked in PCMHI or primary care mental health integration within VA for a number of years before transitioning into this role, and more specifically worked within geriatrics and then our LGBTQ plus healthcare programming. So really excited to be here, and thank you.
Thank you so much. It's a pleasure to have you all here today with us. So we'll start with some questions regarding the ever popular topic of COVID. How will you be considering the impact of COVID in your review of internship and postdoc applications this year? Will you be making significant changes compared to last year's recruitment strategy?
I suppose I can start. I think it'll actually be quite similar to last year. We plan on doing all virtual interviews again, as we did last year. And I think the biggest impact that I saw to applicants was really face-to-face hours. When COVID first hit, it seemed like a lot of people were taken off of their practicum sites, and which is to be expected. And so I think across the board, people saw maybe a decline in the number of hours. But otherwise, I don't think there was really a large or significant difference that I noticed in the applications that we received other than that.
Yeah, I can echo that. We don't plan to have any significant changes to our interview process. And in terms of how we're reviewing applications, I expect there to be some COVID-related changes or differences, and with a lot of variability across applicants, just given the differences across geographic regions and such. And so I'm trying to employ more of a strengths-based model here rather than a deficit model. So while we understand that things may have changed or opportunities may have been lost, I also want to hear how things have, how folks have grown, and specifically to utilization of telehealth modalities and other ways that we've had to adapt in the context of COVID. So I certainly anticipate that this will have an impact, but I'm really optimistic that it won't have be a huge detriment to our applicant pool. I'm hoping. So we're certainly not looking at it from that vantage point. And we are doing the same thing, all virtual interviews. We probably won't change much from our process from last year because it actually seemed to work pretty smoothly.
Yeah, we're also going to do all virtual interviews, which we don't really feel like had too much of an impact on our ability to kind of recruit folks. We also had, I think most places when you're looking at internship applications, it's very individualized anyway, and we have the ability to read thoroughly and you kind of look for people's story, and we don't have a lot of like hard and fast, this gets you sorted into the no pile right away kinds of things. So we just look forward to kind of reading folks' story and making, we've all lived in the past COVID world. We all know what was going on, and we don't really expect to have to make any really radical changes to our usual process.
Thank you. So from your perspective, what were the pros and cons of interviewing virtually last year? And how can trainees best prepare for virtual interviews?
That's a really good question. I think a great pro was that it allowed us to meet with people who might not have normally been able to make the trip out to see us. It provided a lot of flexibility to folks, and we really got to, I think, talk to the best group of people that weren't really having to consider a lot of other factors like scheduling and travel time, and and the cost of doing those interviews. It made it a lot easier to just focus on the folks that we wanted to interview. That's putting a really positive spin on it. It was also really challenging, I think, to figure out how to take our usual interview day and make it come across virtually. That's something that I think is really important with the internship interview experience. You want to feel the place out. You want to get a sense of the culture. You want to see how the people fit with you. And so I think it's an ongoing process to figure out how we can do that best. But that was the thing I was most worried about. Like, are we going to come across okay? Are you going to be able to tell what kind of place this is in a virtual interview? So that was the biggest challenge for us.
I definitely agree with those statements. I think the biggest pro for applicants is definitely the cost. Definitely helps a lot with the cost. You can interview across, maybe different areas of the country that you might not have otherwise been able to do. Meet with, different sites that you were interested in, but maybe couldn't afford to fly there or something like that. And so I think that definitely evens the bar for a lot of people who are worried about the cost of things. And I agree with being able to portray the culture of our site as well virtually. That was my biggest concern actually of doing virtual interviews. I think from my perspective and the other interviewers at our site, we thought we could get everything that we wanted to from applicants and make our decisions kind of similarly to in the past, but really being able to convey kind of the culture of our site, what it's like to work with our supervisors. And we still allowed them we had some time where they could meet with our trainees separately, which I think was helpful. And I'm definitely still soliciting feedback from our current trainees and how it went last year, and if there's anything else that we can do to really communicate what our site is about, because we want people who end up with us to be happy with the site that they've gotten, and that we do want to portray our internship site accurately for people too.
Yeah, I will echo all of that. We actually, I think maybe perhaps surprisingly, all really valued the virtual interview process, and I actually was able to recruit more staff to be involved in interviews, and it actually worked a lot more efficiently on our side. I agree. It was a lot about, well, how are we going to come across? How do we convey our camaraderie and our energy and our culture here when folks aren't visiting us physically? It's by far the most equitable way to conduct interviews. And so we were really grateful to see folks from all over the country wanting to interview at our site. I think the thing that is still coming up for us, and it's more of it's not so much we don't have a decision made yet, but essentially we're still trying to figure out if we will offer some sort of optional open house or guided tours. We want to be very clear, though, that if we do that, that is not an expectation, and that it will be like completely independent of and separate from any of the evaluative process that we have for our recruitment process. So that's the part that I certainly would never want anyone who's applying to feel obligated to come to see us. But if somebody wanted to come, I also want to make that available. So I don't know if others have thoughts about that. That's something that we're definitely grappling with.
We've talked about that too, and how to make that happen, because my fear is, like kind of you touched on, that applicants might think that it's part of the evaluative process, or if they don't come, it doesn't mean that they're taking our site seriously. And I like how you phrase that, because we're of the same mindset. It's just kind of if you want to come, but I'm also fearful that the applicants will still maybe put pressure on themselves if like they have to show genuine interest or something like that. So we've had similar conversations at our site.
We have as well. I would say at this point, we're leaning towards not being able to figure that out. Although there was some talk about, could we schedule something after the sites rank, but before the applicants rank? Like, could we squeeze a little visited there in that window where it would clearly be not evaluative? We definitely don't want anyone to feel like even an unintended pressure. But we also know that coming here and seeing what it's like is really important. So, I don't know. I think it's a challenge that's not going to go away.
Yeah, thank you. So I know it was touched on a little bit earlier, but thinking about your own site and after talking with colleagues, do you feel like sites were able to recruit strong applicants comparable to, pre-pandemic recruitment?
Absolutely. I felt really good. Well, so I will also preface this by saying last year was my first year in this role. And so I didn't have a template to work from in terms of coordinating interviews from the year before and being a part of the recruitment at Jesse Brown. But in speaking with staff and kind of looking at how the recruitment process shaped up, I know we were all very happy with how things turned out at all levels of our training. And so, yeah, I would say we were really, really excited.
I had mentioned too that I was a bit concerned about being able to portray our culture and whether people would be, and I think sometimes people think of Detroit and that's maybe not the most desirable area to live. And so I thought by people coming to visit us in person, that really helps, communicate our culture and how great Detroit is and how it's fun to live here. And I was really concerned about that for being virtual this year. It actually went really well, and we still recruited really strong applicants. So I was really pleased with how we did.
Definitely the same for our side. We were, I think, incredibly worried going in and really pleased coming out. It went just as bad as well as we could have hoped for.
Excellent. So in terms of a more internship specific question, if trainees are interested in health psychology, should they also consider applying to general tracks or looking more towards sites that are pretty focused on health psych?
We don't have a general track at our site, but I know even when I was applying for internship, I did apply to some sites that had both health psych and general tracks, but those tended to be the sites that if you did the general track, there were also health psychology rotations. I think in order to be competitive for a health psych specific postdoc, it's good to at least have a health psych rotation. And so if a general internship still offers that, I think that would be just fine.
I agree, and will speak for our site. We do have both a health psych and general track, health psych track and general track. And we typically do get, I would say maybe half of our applicants who apply to our health psych also apply to our general track. And in part because we do offer some of our health psych focused rotations to our general track interns. So what I would say is that I would tell someone who was really health psych focused, who didn't want to do anything outside of health psych, the general track might not be the best fit because we can't promise a full training year of health psychology focused rotations on the general track. But if you are looking for some exposure and a little bit of a more of a balanced training year, we can absolutely prioritize those health psych focused rotations, but you would be doing some mental health, more kind of general mental health focused rotations as well.
I agree. And for moving on to that next step, it's really more about, being able to say, I have experienced these things and now that's how I know what I'm interested in. And that doesn't necessarily need to be a full year. So there's a lot of variability, even amongst general tracks, who share a lot of overlap with health psychology rotations or experiences. And that can often be enough. I'm not the director of our postdocs, but we have several health psychology postdocs, and really they're more interested in how the person kind of got to what their exposure was and how they knew this is what they wanted to do. And you don't have to know everything when you're going to that level of training. So you can get those exposures in a variety of different ways, I think.
Great. So a few questions kind of more specific to postdoc trainees. How important is it to know what you want to specialize in for postdoc and going through that application process?
I think it depends what you mean by specialize. I think if you, this is obviously through health psychology. And so I assume the question is maybe specialize within health psychology. And I think you don't really need to know. I really, and I tell this to our interns too, when you're looking for fellowships, this is still another training year. It's still a chance to expose yourself to different things that you may have not tried before to see if you're interested rather than picking, your niche area for the rest of your career. And I think it's really important to remember too, within health psychology, there's a lot of transferable skills you can get with whatever sort of rotations you do that can transfer to another form, in the future. So for example, maybe you do something on fellowship doing, pre-surgical evaluations for bariatric surgery. And maybe in your career, you're not going to do bariatric surgery, but you're interested in transplant. Those are still pre-surgical evaluations, still a transferable skill. And so I think it's totally fine to not know what you want to do. I still joke that I'm still trying to figure out what I want to be when I grow up. And I think that's okay. I think change is totally fine and acceptable, and don't put pressure on yourself to figure out what you want to do the rest of your life for your postdoc.
I would definitely agree with that. I think we don't have a health psych focused postdoc at Jesse Brown yet, but that is something that I think with regard to our other tracks and my experience based in working at another facility and was involved in the health psych focused postdocs there, we're looking for some kind of relatable experience. So, and on internship or in practical experiences that you have, as well as I would say broader interest in health psych, but even site to site, what constitutes health psych at that specific facility may look very different. So if you think you might want to do more outpatient focused, like primary care, more kind of general focused health psych, that's fine. That's an opportunity for you to get some specialized skills in that area. If you know that you want to do something highly specific, then I would definitely prioritize those sites. But I think generally speaking, as far as my vantage point, I wouldn't say that it's crucial to know exactly what you want to do.
Thank you. Also on the same line of postdoc, if there are postdoc roles that are more research oriented, but still wanting clinical exposure to fulfill licensing requirements, how would one go about asking about that and requesting that potentially?
That's actually a question that I'll just get emailed to me even before our application deadline. For our fellowship, we actually have a couple different fellowships at Henry Ford. I oversee kind of the more clinically / research focused kind of combined fellowship. Our site also has a 2-year specific research fellowship that I don't oversee. And so if people are interested in both, sometimes people have applied to both. I've even had an applicant in the past who did our clinical health psychology fellowship with about half research, half clinical, and then she stayed a second year to do full clinical. So she still got her hours that she needed to do to fulfill licensure requirements the first year, and then it did a full year of research the second year. So definitely reaching out to directors or research mentors if there's someone specific that you want to work with, and asking about the potential for clinical experiences. And I would say definitely ask, even if you know people had gotten clinical experience in the past, because depending on what those clinical experiences were, those can change from year to year as well. So for example, if somebody had an intervention study and somebody was serving as an interventionist, that might not be the same opportunity for somebody who's applying this year. So definitely just reach out and send an email to ask. I think is totally appropriate.
Excellent. So now we'll kind of move to some more general questions about, applications and things. What are some tips that you all give trainees when it comes to writing essays or cover letters for both the internship and postdoc applications?
Proofread. Edit. Make sure that the address and the person you're writing to gets sent to the correct internship. The little things, right? The little things are they won't necessarily get you put in one pile or the other, but they're very easy to solve. So don't even give anybody the opportunity to do that. We also really encourage people to kind of take their time in their cover letter to explain why we provide the training that they need. How are we your next step? That's really what we're looking for with interns is we don't expect anyone to be an expert at anything. If you're an expert at something, you can teach me things, and then that gets things all messed up. That doesn't work. So we really like to focus on the match between the intern's needs and what we provide at the internship. So anything that you can do to focus on how we match together is going to be of benefit to everybody.
Absolutely agree with that. We're like one of the primary things that we're looking at is goodness of fit between the applicant and our site, and what can we do to support you in furthering your training and professional development goals, and how does that map onto what we can offer you. So absolutely agree with all of that. I think one of the other things that I look for is authenticity and to be as specific as possible. I don't mean a bunch of self-disclosure. I just mean like anything you can do, and this kind of ties into some of the editing features that you can pay attention to, but anything that you can do to show that you've done your homework, to research the sites that you're applying to, that this is actually a site that you would want to potentially train at, and why, so that we can understand that more fully in your application materials, particularly in your cover letter, which really is kind of your opportunity to give us your elevator pitch about why we should want to work with you and you want to work with us. And so, but authenticity does really come through, and the more generic or non-specific you are, I think the harder it is to really get a sense of who you are, which is really what we want to know more about.
Definitely agree with what everyone's been saying so far. I think tailoring the cover letters is really important so that each site knows why you're interested in them and why you're applying to them. And then to also speak about the essay, I know Dr. Matthews was getting a little bit at this too, but I do think it's important to personalize it too. When I read the personal statement, I really want to learn about you as a person and know something a little bit more personal about you. And so if it's a bit generic or a bit vague, it's harder for me to understand who you are as a person. And I think communicating, and back to the cover letter, communicating your interest about a site is also crucial, because if I can tell you're excited about the site through your writing, it makes me more excited about you. I think cover letters are so important because it does give you the chance to kind of sell yourself beyond your CV. And it's something I think is so important. I even do a full didactic for our interns on writing cover letters and kind of giving them along the way.
Can I give one more plug? This is something that's come up in recent years when I've been doing some cover letter feedback of, don't be afraid to sell yourself. Like, you're awesome. You've worked really hard to get here. So whether it's internship or postdoc or whatever job you might be applying to in the future, like, please don't be afraid to sell yourself and why you're so fantastic.
Hello.
Excellent. Well, thank you. And just a reminder for everyone to put themselves on mute if they can. What are the most important things we can do or emphasize to be competitive for health psych internships specifically? Let's say someone has mostly done general training up until this point, and now they're starting to look at health psych sites for internship.
At the risk of sounding, like a broken record, it really is about just telling the story about how you got to be interested in this and what is at our internship that you feel like you can benefit from. Whether it was a research experience, lots of folks have, broad general clinical experience, but they've gotten really interested in health psychology research, and now they want to flesh out their experience with that clinical piece. Or they had a bunch of different experiences and a little taste of something health psych and got really inspired by it. We love to hear that as well. It's also totally fine to tell us that you've had a lot of experiences that kind of confirmed for you this was not what you wanted to do, and how you learned that this was how you wanted to do. Really just emphasizing kind of what your story is, how you got interested in coming to the health psych world.
I do think it could be helpful if you do have a lot of general experiences to try to expose yourself to some health psychology experiences if you can, to make sure it is what you're interested in. Like Dr. Ledroski was saying, even through a research experience that could be helpful, or even if you're doing a more general experience, but you have the opportunity to meet with somebody who has chronic medical conditions, I think that could be really useful as well.
I agree. I think specific to our health psychology track, the rotations that we offer are, it's not that you have to have direct experience with any of those individual rotations, but we are looking for how does what you've done kind of map on, even if it's indirectly. So I do think if you have the opportunity, if you don't have direct exposure to a health psych focused practica or coursework or research experience, that whatever you can do to show evidence of some type of self-initiative in learning, in taking on, whether that's like self-taught or whether you're finding other mentors or teachers who might be able to work with you above and beyond what you're already doing, that will go a long way to show that you do have a demonstrated interest, particularly in our health psychology track.
Excellent. So in your opinion, what is the most important part of the application packet as a whole?
This is a really hard question, I think, because my first answer is, well, we don't have a most important part of the packet. We weight multiple parts of the packet equally, and we look at it in the context of the whole packet and whole application, all the materials that we receive. And we look at it in what I would call more of a balanced way, where maybe somebody has an abundance of research experience, but that means they don't necessarily have as much clinical experience. We weight all of that kind of in context of each other. And so, and we do that before and separate from, we look at you as an individual, and then we do that before we actually look at you in comparison to the other applications we receive. So I want to emphasize that at least at our site, we don't have like a most important part of the application. We look at you very holistically.
I agree with that as well. We have a form that we fill out on each of our applicants that kind of go through the different parts of the application that we review. I would say, though, that the first thing I do read is the cover letter. Now, I wouldn't say it's necessarily the most important, or it's going to, weigh most heavily on my mind or anything like that. But that's what really helps, I think, set the stage for me in looking at the rest of the application. Because again, like we said, it's tell yourself and kind of talk about yourself beyond your CV. And so in reading that, I feel like I get a good sense of what's to come in the rest of the application.
Totally agree. We read the entire application, but I start with the cover letter too, and I feel like it kind of sets the stage. It sort of directs me for what I really want to know more about in terms of the rest of the application materials. I will say we have several faculty also. Most places have multiple people reviewing the packets, and people tend to look for the things that they're interested in. So different reviewers look at things different ways. So you can be sure that the entire application is getting looked at by somebody in some way.
Thank you. Any examples of things that stood out in either good or bad ways in essays, cover letters, references from your past experiences?
One thing that we look at as a site that's really important to our values as a training site is if I see a lack of self-awareness or just sort of a general lack of interest conveyed through the diversity essay, that is something that we do look at. And I have noticed that applications that have applicants who have, even if they don't necessarily have a ton of diversity focused experiences, that they're thinking about these things, that they're conscientious, that they are demonstrating some semblance of self-awareness. Those are the things that I've noticed that may lead more heavily toward a higher rating on that particular component of the application.
I think too, I mentioned this earlier, but I think I really like to see something personal in the personal statement, again, to tell me a little about yourself as a person. I've heard some graduate DCTs of graduate programs have told people to not reveal anything personal about themselves. So I know people have gotten that advice too. So it's not something that I'm like too overly critical or something about, but I do like to learn about you as a person. And just, we haven't talked as much about reference letters. So I will say, when you're asking for reference letters, ask your writers if they're able to write you a strong letter. I think that's important because it's actually fairly rare that I receive a bad letter from a letter writer. But if I do receive a letter that sounds like some potential red flags, then that's a little bit alarming for me. And it doesn't happen often. It's something that's pretty rare, again, because we mostly see good letters. Sometimes we see some outstanding letters, sometimes there's good letters. But if there's anything in there that's not strong, or it may be a potential red flag, it does raise a lot of red flags for those who are reviewing applications at our site.
I totally agree. It's a very difficult conversation to have as a graduate student. I want you to write me a letter. Will you write it? Are you going to be able to write me a strong letter? It's really hard to say that, but it's totally valid to say it. And it's okay to say, okay, no, thank you, if somebody is lukewarm in their answer. We do I don't know, this is another thing that we really kind of value is when the whole application together really kind of hangs together and tells somebody's story of their development to this point. So whenever they can weave, just kind of really authentically telling your story about yourself, how you got interested in these things, when all the essays feel like they were related to each other and written by the same person, that always feels really kind of good and coherent. It's rare that you see a really, kind of a bad essay. I think most people do a very good job writing a good essay, but whenever you can kind of connect them together to your larger story, that's how things kind of go from, yeah, this is really good, to, oh my gosh, this is really, really good.
I guess one more thing about essays too, definitely have somebody else, at least one other person, hopefully two people, read your essays. I know someone mentioned that for cover letter. I think this goes for essays too. I think there's been a few times where I've read essays, I'm like, oh, I don't think anyone else has read this. Not necessarily that it was bad, but maybe there's really run-on sentences that it's been really kind of hard for me to interpret what they're trying to say. So definitely have a couple of people read it.
One thing that I'll just add on to that is that if there are areas of growth, so if you've had an experience that's going to get disclosed in the context of your application materials, or if a DCT is going to write a statement, a training statement on your behalf that's going to include something that maybe it might be somewhat detrimental to your overall rating or candidacy for a particular site. I'm all about owning that and kind of talking about what you've learned or how you've grown from that and addressing that, rather than trying to kind of stick it in the middle somewhere so that it doesn't stick out. So I actually don't mind when I see letter writers who write really strong letters and also identify the ways in which a student has grown over the course of the training program, whether, you know, if it's a mentor or a research professor, whoever it might be, a former supervisor, I really value that, because if we're not here to learn, then, you know, what are we here to do? And we still want to be able to teach you something when you come to us. So if you're perfect, then I don't know how we're going to be able to support you either. So being able to be authentic, but highlighting if there are areas of growth, that's okay. That's okay. Just please be honest about what those might be, and that it's okay if your letter writers are too.
Thank you so much. We've now reached the portion of the section of this panel where it's open Q&A. So people can feel free to unmute and ask their questions aloud if they feel comfortable. Just a reminder that we are recording still. Or you may add your questions in the chat box. I'll give people a few moments to kind of gather their thoughts here.
I have a question.
Yeah, go ahead.
So what role would you say supplemental materials play in the application process? I feel like a lot of time is spent on cover letters and essays, but I don't think many people talk about the supplemental materials that you guys ask for, like the treatment summaries and testing reports and things like that.
So we actually don't ask for any supplemental materials on our site. So for our site, it's not at all important.
I will echo that. With the exception of our neuropsychology track, we have an optional test report that we allow applicants to include if they prefer to.
We also don't ask for supplemental materials, so it's hard for me to say how a site would value that.
Thank you.
Maybe if they ask for it, they might care about it though.
Okay.
Dr. Matthews, how does your site handle the neuro supplemental report?
We allow for it as an attachment in the supplemental materials section. So it's something that if folks want to include it, they are encouraged to, but it is not a requirement. And I will say that having participated pretty actively in the neuropsychology recruitment portion of our internship last year, we did not weight one way or the other if a report was there or not. It did not weigh into whether we invited someone for an interview.
Thank you.
Sure.
In the chat box, we have a few questions here. So the first one, if you're an applicant with a lot of health psych experience, is it okay to apply to rotations where you already have experience? For example, if I have a lot of experience in psycho-oncology, can I apply to oncology rotations if I believe the site still offers something new in oncology to me?
I would say absolutely. Absolutely, for sure. I think a lot of our conversation was kind of geared towards people who might just be kind of coming to the health psychology world, but there are certainly folks who have you know, a really kind of solid understanding of where they want to go professionally. And the second piece is really important, where you kind of highlight the parts that are new, right? So that it looks to the site like there's still, like you still can get something from them, because then we'll be interested in training you. But absolutely, for sure.
Excellent. Another question, how would you recommend to stand out in the interview process?
I really think it's important to just be yourself. I think as long as you come across as genuine, that's what we're looking for. We're not looking for like any particular characteristics. Like some people, so I'm more introverted, so I feel like I'm going to struggle during interviews, and that's totally fine. We've matched with many introverted people in the past, and so really just be yourself. I think if you're not being yourself, you're probably not going to feel comfortable doing that, and that might come across to us. So just be yourself, I think, is the most important thing.
I agree. This is an inherently stressful process. So part of the work that we try to do as a site and with individual interviewers is to try to create a playing field that's as equal as possible, and where we're going to try to keep all of us being comfortable, because some of our interviewers don't always feel super comfortable being in front of a camera either. I know I still get anxious doing things like this and talking to a group of people. So authenticity is great. Ask questions that, you know, I think are going to be useful in making an educated decision for yourself. We want trainees who want to train with us. And so please get as much information as you can in the interview process. to help make an educated and informed decision for yourself.
That's really, really true. It's the important questions to you are the important questions to you. And if they're important to you, then they're important to us to answer. There aren't any best questions or right questions or wrong questions. Whatever an applicant feels like they need to know to get a sense of whether this is a place they want to go is a good question as far as we're concerned.
Thank you. So what is a recommended number of sites to apply to? I'm assuming for internship, but you could also answer this to postdoc. And also concerns about those who are geographically limited. Can you speak to that?
I'm probably not the best person to answer the how many sites should you apply to, because I feel like it changes and your DCTs probably have recommendations about this. But I will say with regard to the geographic limitation, along those lines, if you are geographically limited, and let's say you're interested in health psych and the number of sites that specialize in health psych or offer those opportunities are limited, find out as much as you can about the other sites to which you're applying and see if there's any flexibility in their training, and see if there might be an opportunity to even work with the DCT at that site to even create a rotation. I will say, like at our site, we try to be pretty flexible. So if someone comes in with a really specific training goal that we don't currently offer, like I will do whatever I can to try to make that happen for the trainees. So particularly for those of you who may have some geographic limitations or other site restrictions, please do try to get as much information about the sites to which you can apply.
I think APIC also posts like the number of sites that people apply to each year. So you can definitely check their site to see last year, kind of on average, the number of sites that applicants had applied to. It does seem for fellowship applications that our applicants apply to fewer sites for fellowship than for internship. It seems to be less competitive overall. And so it seems to be, several sites fewer for postdoc applications.
Thank you. In terms of health psych internships and ones that have health psych rotations, how much assessment experience are you looking for in applicants?
To be honest, this is something that I think I struggle with, putting like an actual number on something. I think too, I just had somebody email me a couple weeks ago to say, I saw on your site that you have 100 hours required for assessment. I only have 80. Is this enough for your site? Like, would you throw my application out? I said, absolutely not. I think too, it's how you define assessment. Are we defining assessment as an actual testing battery, or assessment as doing a clinical diagnostic interview? And so I think people will define that differently as well. And so I don't think there's like a specific number that's a golden number. I think as long as overall, if you have a decent number of face-to-face hours, that's kind of, I think, what matters the most to our site. And beyond that, like, we also know you're coming to us for training. So we're not expecting you to know everything already. That's why you're coming to internship. And so that's kind of our approach at Henry Ford.
Totally agree. We actually just request a certain number of combined hours because we understand that people's training experience can be really variable. And kind of, one of the things that we expect to do is sort of train you in the things that you need to know. So if you have kind of our basic number of face-to-face hours, then we're flexible in figuring out what else that means for you.
Great. So, and the next question is, we've talked a lot about how applicants having more generalized experience, wanting to pursue something in health psychology. Have you ever encountered those who have a lot of experience in a specific area, or can transferable skills help with this?
Yeah, I think that's really true. We understand that people's graduate training programs can be incredibly different. And some folks come to us with quite a lot of experience in a specific area, bariatrics or pain or something like that. We're clear about what we expect, that we provide generalist health psychology training, and we talk about the ways that the skills that people have already learned might apply to these other populations or these other tasks. But really flexibility is the name of the game, and we've had things go in both directions and had to be a great experience for our interns.
Kind of what I was saying back to postdoc too, about how it can be just another training year, another experience to get a different sort of training experience. So if you do have a lot of experience in one area, but want to learn about these other areas that we can offer you, there's a lot of transferable skills that you would have gotten in that, the particular area that you did, that you can now transfer and use at our site, while also learning more while you're at our site as well.
Thank you. Oh, go ahead, Dr. Matthews.
I was just going to echo and say I 100% agree. I know we're getting short on time, so I don't want to add to it if I don't have anything to.
Fair enough. For those who may be switching their careers after spending a long time in a different one, how is that perceived during an internship process?
I will speak for myself here as someone who spent years in another career before going into psychology, that I personally, it's not something that we kind of think of negatively or positively. It's another data point in your experience. And I'm really curious about, like, what does that mean for you? And like, how does this potentially load into your decision to become a clinical psychologist? Why did you choose this path after perhaps being in a different career? I have encountered instances where there's like a question or concern if there's a gap on a CV where it's not all psychology specific. And I think that the important thing is that if you do have some notable time and it's not accounted for in some kind of way on your materials, that if you're comfortable sharing what that's about, that's fine. But frankly, it's none of, like, in a lot of ways, it's also none of our business. And so I personally think that we don't look at it, like I said, either positively or negatively, but if it's something that you want to speak to because it's important to you, then I would certainly encourage you to share with us what that trajectory looks like for you.
Excellent. So I think this next question is kind of more specific to each of your sites, but would you characterize on a demographic and epidemiological level the patients or clients that interns or postdocs would potentially work with at your sites?
So I think one of the things that we really prioritize in our internship is flexibility to meet interns where they are. And we have the population in our geographic location, right? So we are in a rural Appalachian. We're in a tertiary care medical center that draws from the entire kind of state of West Virginia and beyond. So we tend to serve folks who are driving far, who don't have a lot of access to service, and in general come from that kind of rural Appalachian culture. But we also exist in the university kind of bubble, and so serve a wide variety of folks who are here to provide service at the university or the hospital. And so you have your general population that you draw from, but we work closely with all of our interns to make sure that their individual needs are being met. So if you haven't had any opportunities to do clinical work with a certain population, we work really hard to make sure that the internship year is filled with both breadth and depth for people within the bounds of what's possible in our geography.
One of the things I love about working at Henry Ford is we have a lot of diversity. So a lot of the patients that we do see are within Detroit or the Metro Detroit area, but we also do pull from farther away for some of our rotations. And so we'll have rural populations as well. And so really wide range of racial and ethnic diversity. Sociodemographic factors are across the board, which I'm a person who gets bored easily. And so by having that diversity, that's something that I really appreciate. And it's something that we also work with our interns on as well. If they haven't had exposure to working with a particular group of patients, then that's something we do try to prioritize. And then we also do kind of weekly cultural presentations as well for our trainees on Fridays. So if someone hasn't had exposure to it, it's something that they'll get exposure hopefully across the internship year.
So First and foremost, we're a VA facility, so you'll be working almost exclusively with veterans. We are also an urban medical facility, so most of the veterans, the majority of the veterans served by Jesse Brown identify as Black or African American and over the age of 55. We do have a growing number of women veterans who utilize our services. We also serve a growing rural population in the Northwest Indiana region. So it's a very diverse group of veterans, but one thing I neglected to mention in the what could be important to include in your materials piece is that if you are interested at working in a VA, I would potentially consider mentioning why you might be interested in working at a VA or with veterans more specifically, because it is a different healthcare system and it's a different patient demographic. And one of the things that we do try to prioritize as a training facility is trainings on military culture, on eras of service, on working with different demographic groups in the veteran population, on military sexual trauma, et cetera. So that's another kind of diversity factor that we will embed throughout the training year. We are what's called a 1B level facility, which in the VA means that we have a variety of both outpatient and inpatient medicine units, inpatient psychiatry. So we have just about everything except some of the longer term residential care that some of the larger VA facilities house. Like we do not have a spinal cord injury or a blind rehab center or a very large nursing care facility.
Thank you. We'll answer these last 3 questions in the chat and then we'll wrap up so that to give people some space to get to their next meeting. Do you recommend applicants reaching out to DCTs with questions before submitting an application?
I think it depends maybe what the question is. If it's something that's going to affect whether or not you want to apply to the site, then absolutely feel free to reach out. I think if it's something that you're planning on applying to the site, you're going to apply to it regardless of what that response is, maybe that's a question you could hold for the interview.
I think that's a nice way of capturing it.
Absolutely.
Excellent. How much does a PsyD versus a PhD matter versus a counseling versus a clinical degree when it comes to the application process?
It's probably really variable by site. I can say at our site, it's makes no never mind. It's really about the individual's kind of package, and we note it, but it doesn't weight more heavily in any direction.
Likewise.
Yep, I was going to say same thing with us. And also when you're looking at sites on APIC, you can also look at recent matches for their sites, and that'll show whether they're PsyD or PhD or counseling or clinical. So it can give you a kind of a insight into not necessarily like would they consider your application if you're PsyD or PhD or clinical or counseling, but at least who they've matched with in the past. And so you notice over the past 6 years they've only matched with counseling sites, then maybe they don't care as much about clinical, or maybe they prefer counseling. But again, it doesn't necessarily mean that because it is a match system, it doesn't show you who they actually interviewed, but at least can give you some insight into that.
Great. And then the final question for today is, do you consider practicum hours that applicants accrue during master's programs in the same way as you do for their doctoral level practicum hours?
I think generally once someone has hit like a certain number of hours, the number of hours doesn't really matter quite as much. So if somebody has, few doctoral hours, but they've had a lot of master's hours, that kind of gets you to that, that threshold. I think, yes, I would definitely take that into consideration. But if somebody has enough doctoral hours already, having master's hours isn't necessarily going to like really ramp you up and put you high up there, because again, you've kind of met the minimum threshold.
Yep, I agree. That's also how we consider hours.
Same at our site as well.
All right. Well, thank you so much. It has been a pleasure. On behalf of the Student Advisory Council and the Society for Health Psychology, please join me in thanking our panelists for taking the time to share their wisdom with us today. And thank you to all members of the audience for your attention and engagement. Just a quick reminder to join or renew your Society for Health Psychology membership for 2022. This will enable you to participate in the teleconferences, webinars, listservs, awards, and other benefits all year, and for the remainder of 2021 at no extra cost. It is also not necessary to be an APA member to join Society for Health Psychology. As stated earlier, the recording of this program will be posted to the website. And if you have any follow-up questions or comments, feel free to email us. I will put the email in the chat, studentchairdivision38@gmail.com. We look forward to seeing you at future society events. Thank you so much and take care.